Dr. Shelly Singh. I'm Senior Consultant Obstetrics and Gynecology at Rosewalk Healthcare. So today, let's just talk about the contraceptive methods which are available to us. Now, there are a large number of contraceptive choices which are available to you, and often you want to know which one is best suited for you. So remember, always discuss it with your doctor and try to use the one which is the best suited for you. Also remember that if one does not suit you very well, you have the choice of replacing it with another method. So what are these contraceptive methods which are available to us? So they could be some of the methods which are temporary, or there could be permanent methods like a vasectomy or tubectomy. The temporary methods include barrier methods of contraception like the male and female condoms, the cervical cap, the diaphragm. Apart from that, we also have methods like the intrauterine contraceptive device. We also have the intrauterine system which contains a progesterone like the Mirena. We have the pills like the combined oral contraceptive pills, the progesterone only pills, and other methods like a contraceptive patch. There is a vaginal ring, as well as injectable agents and an implant which is also called Implanon. All these are available in our booking. We also have the rhythm method of contraception. So now which one do we actually choose? Now the important thing is that a lot is going to depend upon the kind of person that you are. In case you are a person who is very well regulated in whatever you do, are not a very nervous person, do not have any medical problems, and don't have a problem with using contraception on a daily basis or every time you have intercourse, then of course we do have the methods like a condom. It could be a male or a female condom, a cervical cap or a diaphragm. Now if you want to use a method which you need to use every day, you can use the combined oral contraceptive pills, the progesterone only pills. Remember always that you must not be forgetful if you're using these methods. If you feel that you're going to forget it every time, then it's better to use a low maintenance kind of a contraceptive. Like for instance, we have either the implants, we have injectables. Apart from that, we also have intrauterine contraceptive devices which are the copper containing ones, or also Mirena or the progesterone containing one. So these are the low maintenance kind of contraceptive devices which are available. So a lot is going to depend upon your lifestyle, the kind of person that you are. Now, in case you need to use something every week, we have the contraceptive patch. In case we need to use something every month, we have the vaginal ring. Every 2 to 3 months, we have injectables. Now, if you want to use something which needs to be replaced about 3 to 5 years, we have the intrauterine devices, for instance, the copper containing ones, or the intrauterine system like the Mirena. And if you want to use something which can be replaced every 10 years, we have another kind of a copper containing device that is also available. And implant needs to be changed once every 3 years. So there are various methods that are available. Now let's come to some of the questions that are often asked to us, and then how we decide on a contraceptive. Let's just consider some of those things. If you want to prevent sexually transmitted diseases, the only good contraceptive choices for you then would be a barrier method of contraception, which can be used alone or even in combination with some of the other methods that you use. So these are the male and the female condoms, the cervical caps, as well as the diaphragm. Now, in case you are comfortable using vaginal methods of contraception, then we have the female condom, we have the cervical caps and diaphragms, we have the intrauterine device, which is the copper containing device like multilode, and we also have the intrauterine system. For instance, we have the Mirena, and apart from that, we also have some vaginal rings that are available. So in case you are not comfortable with vaginal methods of contraception, these methods are not for you. Now, if you're comfortable with a slight change in your periods, then of course, let me just tell you some of the problems which can happen. Now, when we start using progesterone only devices, for instance, if you use progesterone only pills, if you use an implant which contains only progesterone, or if you use an intrauterine system which is progesterone containing like the Mirena, you will have very minimal periods, or you may not even have a good flow, and occasionally the periods may stop completely. So if you're comfortable with that, that's the method for you. However, if you want to regulate your cycles and you want that the period flow should also be a little less, then we have the combined oral contraceptive pills, which are a good method for you. Also remember that copper containing devices, for instance the copper T, the multi-load, etc., are going to cause heavier bleeding compared to normal. Now suppose you are a smoker. If you're a smoker and you are more than 35 years of age, I will definitely not recommend the estrogen hormone containing devices for you. So in that case, the options which are available are either the barrier methods of contraception, we have the intrauterine device, the intrauterine system, or a progesterone only pill. Now, sometimes we can't use a hormonal method at all, especially the estrogen containing methods. Now, who are these people who cannot use these, hormone containing methods? If you are more than 35 years of age and you are a heavy smoker, if you have a history of severe depression, if you do have a family history of thrombosis, which means that there is a history of clotting in your family, whether it is a stroke, in case you have heart disease yourself or a very strong history in your family, even if it is severe hypertension, in case you have undiagnosed vaginal bleeding, in case you have a family history of some of the genital cancers. So in case you cannot use one of these hormonal methods of contraception, remember we have the barrier methods of contraception, and you can also use some of the methods like the intrauterine device which contains copper. So don't really worry about this. In case you cannot use the estrogen component of a pill, remember there are progesterone only pills, there are injectables, there are implants, there are also progesterone only containing intrauterine system like the Mirena, which are also available. The same choices extend to someone who is breastfeeding, because remember we cannot give you combined oral contraceptive pills while you are breastfeeding your baby for the initial 6 months at least. In this time, you can use the progesterone only pills, you can get an implant inserted, you can use even the injectable which contains only progesterone as well as a Mirena. So there are numerous things which can be done. Also remember that if you have associated problems, so many people do have a problem of acne, there are problems like heavy bleeding, there is polycystic ovaries that are there, cramps while you're having menstruation. A lot of times then the hormonal methods, for instance the combined oral contraceptive pills and the other hormonal methods, also help to take care of these as well. So lots of times, it is going to be these problems also which are going to actually define what kind of contraception you are going to use. Now, if you want that fertility should be restored very soon, remember we have some of the methods like again the barrier methods of contraception as well as the intrauterine contraceptive devices. Remember that the combined oral contraceptive pills do take a little longer for fertility to be restored, but it is not as though there will be a complete infertility which happens. That's a myth. So there are numerous choices. There are so many things which you really need to discuss. Do that with your doctor, but remember, prevention is always better than cure.